Well, so much for up and running. Try kinks and it stinks because this healthcare.gov site is still churning out wait times and error messages, bunches of them. Ed Henry on how the White House is responding. Hey, Ed.
Good to see you, Neil. What bottom line is the administration is struggling to explain whether or not they really met that self-imposed deadline of November 30th to fix the website for the vast majority of users. Because you're right, today consumers are reporting they found a new page that they're being put into that's basically a queuing page, we're told, where there's so much traffic that basically folks are being told you've been thrown in a queue to wait basically until they can come back and say, look, there's a better time for you actually to move forward and try to enroll. The administration was insisting today that that is basically a sign of progress because it shows that 375,000 people, they say, as of about noon today or so, early afternoon, had already logged on. They're being thrown into this queued line, and then eventually they're going to enroll. Here's Jay Carney.
This day.
What's the goal then? Just keep moving them into other lines? I mean, the goal is obviously to enroll more people, right?
Absolutely. And
so if they're still
those people
waiting,
who want to enroll, Ed, I would point you to the fact that more people are visiting the site and are able to effectively go from beginning to end when it comes to enrolling than was the case in October and in November.
So the question is whether people are just being thrown from one line to another, and finally whether or not they're going to be able to enroll, because this one deadline has now passed in terms of quote-unquote fixing the website, but there's a new one basically that Jay Carney acknowledged today in terms of a deadline, which is January 1st, when some people are going to have to start getting new coverage under the Affordable Care Act. And the question is, if they can't get all the way through the process to enroll, and the end of December comes up, what's going to happen to the people who are trying to get insurance but can't, Neil?
You know, Ed, I know you can't relate to this, but this visiting the site thing is very analogous to if I went to the Weight Watchers site. Not that I would. Multiple times. Then my diet has begun, I'm losing weight. The reality is, I'm not. So this idea that more people can get on the site seems to argue for either more people liking it or signing up. And that's not necessarily the case. In fact, right now, that is not the case.
Very much up in the air. I mean, on one hand, the administration can tout the fact that there's more traffic on the site, and so that the site can handle more traffic, number one, something they couldn't do before, and number two, people are obviously interested in this product. But you're right, can they actually enroll and sign up? The preliminary numbers for the month of November, we haven't gotten the final ones yet, suggest that a lot more people enrolled in November than October, but let's not forget, they were starting with a very, very low number in October, so there's only one way to go, which is up.
All right, Ed Henry, thank you, my friend. Ed at the White House. Well, meanwhile, for the kinks to the cost, now companies are forced to explain to workers what's behind the price jump a lot of them are seeing in their health care coverage. And doesn't Ron Pepe know it firsthand? Ron is the head of legal and human resources over at Cavuto and finds himself more often than not being the bearer of bad news, not through any fault of his own. What do you tell folks then, Rob? I mean, when they want to know what's going on and you have to spell out the details, I imagine they're not pleased.
They're not really happy, and part of it is they have this expectation that they're getting something that's either not going to cost them much or that their costs are going to go down. And on top of that, I have to come in and tell them, well, actually, the good news is you're keeping your company health care. The bad news is it's going to cost you a lot more than it had been.
And what do they say? What do they do?
We have to walk through an explanation, and we talk a little bit about what some other companies are doing and how it's costing the company a lot of money, but we think it's the right thing to do right now, and we'll keep doing it as long as we can afford to do it. They understand, but at the same time, they're still getting mixed messages when they keep seeing headlines saying that they can go in and sign up for this new product.
You know, I want to hear from a lot of folks, both quite attuned to what's going on in healthcare and those not, is surely the experts had to know that this was coming, that why did we get a lot of these sticker shock details now, where sometimes weeks, if not months before a plan was slated to roll out or private plans were being phased out. What was there sort of like a concerted effort on the part of insurance companies to dupe us, to fool us, or did they too just learn the gravity of all these requirements and that they would necessarily mean costs would spiral?
I get this sense that people wanted to believe. It's sort of like people who fall for scams and they say, well, I really want to believe it could happen, so I'm going to send in and I'm going to respond. And I have a feeling the whole thing wouldn't have passed if folks didn't at least sign up and think it could work. But that was in a perfect world. And as the regs come out and as reality hits, we're starting to see that it's not at all coming together in a perfect situation.
But a lot of these companies, your own included, and your health providers, they knew and they had warned that, look, premiums are going to have to go up and all. But the sticker shock and the gravity of it and the sheer severity of it didn't register until the last few weeks, if you think about it. That's when a lot of companies were saying, all right, we're going to have to cancel this plan, or we can't afford this plan, or you're going to have to pay a lot more if you want to continue on this plan. Did something happen, or was this just a sort of a collective, you know, let's go line by line and price this thing out?
It went as we went along. As you know, some of the requirements got phased in a couple years ago, and as they got phased in, the cost went up. And we sort of at least registered it with our representatives. Nothing changed in the meantime, so everybody kept heading down this path, and we're where we are right now.
Ron, thank you very, very much. Just a reminder to our viewers, and I know I sound redundant on this issue, but as we covered in Washington when this was being made law, if it sounds too good to be true, I know you hear this all the time, it usually is. If you expect to insure 30 million more Americans, keep your kids on your policy until they're 26, cover pre-existing conditions, remove lifetime caps, all wonderful ideas, it's going to cost. Finding out the details of those costs is shocking a lot of folks, but any regular Fox and Fox Business viewers would have been well prepared for what's going on right now. Just remember, if it sounds too good to be true, it is. Meanwhile,